Hi, everybody. This is Dr. Tahir from Family Pediatrics in Kenosha, Wisconsin. Thank you so much for joining me today. Today, I'll be talking to you guys about a difficult topic, and that topic is sometimes very embarrassing for kids and parents alike, and that is a topic about bedwetting. Lots of kids have problems with bedwetting, and it causes a lot of disability in your child's life sometimes, not to mention your own life as an adult, because it's sometimes very frustrating when kids are constantly wetting their beds. So let's look at that. Let's take a look at that. I actually found a really good article that I reviewed, and a lot of the information I talked to you guys about today is from that article, but also from personal experience of treating kids with bedwetting. Okay, so this article is called, let's take a look and see if I can put this here correctly. It's called Nocturnal Enuresis. Oops. Nocturnal Enuresis. Okay, and this is an article that's an American Family Physician. That's a April 1, 2003 article. This article is really good, and it reviews a lot of the problems and some solutions that work and don't work. So what I want you to first know is that kids normally cannot control their bladders at night as they are getting older. So by the time they're about 5 years old, most kids should be able to control their bladders at that point, okay? Up to about 25% of kids at 5 years of age still can't, and they still may wet their bed at nighttime. And when kids are older, let's say about 8 years old, at that time it's about 12% of kids. So 12% of 8-year-olds may still wet their beds. So, when parents come and talk to me about their kids wetting their bed when they're older, it does happen, and it's not unheard of. And when kids are older, so at adolescent age, we're talking 1 to 3% of adolescents. All of those numbers are small, yet they represent a lot of difficulty in life because as your child gets older, they may not be able to sleep at a friend's house if they want to, and they may feel embarrassed. It affects their self-esteem, and it's very frustrating for them as well as for the family. Okay, so let's look and see what causes bedwetting, okay? The most consistent finding is that with bedwetting, a lot of it is genetic. If both parents were bedwetters, then there's about a 77% chance that a child will also be wetting their bed at a later age. So that's important. Now, there's other things that happen in our brain and in our bodies that affect everything. There's a chemical called vasopressin. Vasopressin helps decrease the amount of water our kidneys produce at nighttime. And if that's not functioning well or not at a high enough level, then the kidneys may produce a lot of urine at nighttime, and that may make your child wet their bed. Also, everybody matures at a different rate. So sometimes the connections between the nerves and the brain is still developing and at different rates for different people. Some kids just don't wake up. They are deep sleepers, and their brain just doesn't get aroused when their bladder is full, like we are supposed to be aroused when that happens. And therefore, they may sleep right through, and their bladder gets too full. They end up urinating in their bed. Okay. Also, constipation is a big problem for kids, and if kids are constipated, that also may make them more prone to wetting their bed. If you imagine a bladder full of urine, the rectum is right behind it, and if the rectum is full of stool because of constipation, it's constantly pressing on the bladder, and it makes the bladder small. So the bladder can't hold enough liquid, and therefore your child is more likely to urinate when they're sleeping. So simply treating constipation can sometimes improve bedwetting quite a bit. Now, just as it is frustrating for the parents for a child to wet their bed, it's even worse for your kids, you guys. Kids are often embarrassed, and they feel horrible that they are not able to control their bladder at nighttime. It's a messy ordeal, and it is not the best thing for their self-esteem. So it's very important, if your child is wetting their bed, to not punish them and not make a big negative thing out of it, because they already don't feel very well about it, and it's something that they really can't control, but they really want to. All right. So let's take a look at and see some of the things that you can do to help your children if they are wetting their bed. So first, number one thing you can do is try to help them not drink very much, maybe 2 or 3 hours before they sleep, and try to make sure that they go use the bathroom before they sleep. You can also try to wake them up about 2 or 3 hours after they fall asleep so they can urinate again. and hopefully prevent a bedwetting episode. That may be hard to do, of course, because you'll be sleeping and your child's sleeping, and you both have to try to get up to make that happen. Now, positive reinforcements can work also. So if your child, let's say, does not wet the bed at nighttime, you can give them a little star sticker for the younger kids. And every day that they're not sick, or rather they don't, every day they don't wet their bed, you give them a little sticker, and after they collect 2 or 3 stickers, then they get a little present, a little surprise. So that's positive reinforcement that hopefully will help establish a better pattern of not urinating in bed. Also, if they do urinate in bed, give them some kind of a responsibility. So the younger kids, for example, could help clean up, or they could remove the linens off the bed. And the older kids could help do the laundry and wash the clothes and put them back on the bed for the next morning. They can help change the beddings, okay, at nighttime before they fall back asleep again. So helping them be responsible for cleaning up may also help decrease amount of bedwetting that your child is having. Now, one of the most effective items for helping to decrease bedwetting is something called bedwetting alarms, okay? There are many different kinds of alarms on the market. This is something you can look up online if you search bedwetting alarms, for example. Essentially what these devices are moisture sensors that are clipped on to the underwear. So if your child does begin to urinate, it will pick up that moisture and just alarm really loud. Or there's different kinds of vibration devices, so that will cause vibration and wake up your child also. The idea behind those is that as soon as your child hears the alarm, they'll get waken up and they'll realize they have to go to the bathroom, and they'll go to the bathroom instead of wetting the bed. And over time, this is the most effective way of decreasing bedwetting. And also, when you stop using it, there's the least amount of risk that your child will start wetting their bed again. The reason why this works is because it helps your child to understand at a subconscious level, and your nerves and the nerves to understand when the bladder is full and when to become awake and to go to the bathroom, or to hold the urine and not let the urine pass. So this is kind of a behavior conditioning that happens, and this is shown to be the most effective method, okay? Now, there are other things that we can do, which are medications. There are 2 different kinds of medications that are available. So one of them is called desmopressin, that's also known as DDAVP, and one is called imipramine. All right, so desmopressin and imipramine, those medications help decrease the bedtime wetting also. The DDAVP works by giving the body hormone that decreases the amount of water the kidneys produce at nighttime. And because there's less water produced at nighttime, less chance of wetting their bed at nighttime. The imipramine works a little differently by helping to decrease the muscle constriction in the bladder, and therefore that's how it's thought to work as far as decreasing the wetting at nighttime. The thing with medication is that the medications aren't really doing any kind of behavior training. So once you stop the medications, there's a very high rate of wetting your bed again. Well, that's not surprising, because we're not really changing anything underlying by using medications. All right? So bedwetting alarms are probably the best bet as far as looking to see how you can help your child decrease bedwetting. That topic, the bedwetting alarm topic, is a video in itself. That's something I'll look more into and see what kind of models are available, and do some comparisons with that. All right. I hope this video helps you guys and helps your children. Make sure you talk to your doctor. If your child is wetting their bed, there could be a medical reason, and your child does need to have a examination to make sure there's no problems with their spinal cord, there's no urinary tract infection going on, for example, and some other physical conditions that can cause bedwetting. Thankfully, they are very, very uncommon, and most likely your child will not have a medical condition causing their problems, but it's still important to get checked out. So I hope this helps you guys and gives you some ideas and some hope for your children if they are wetting their bed. Thank you very much for joining me, and I'll talk to you later. Bye-bye.